So in this video of medical education series, I would like to tell you the differences between a long essay question, structured essay question, and short answer question, and modified essay questions. So the first is the long essay question. Now in a traditional teaching systems, it had an important role, but now recently research says that it doesn't check your knowledge and clinical reasoning or judgment. It just checks your recall, like describe the pancreas in detail, or describe the anything in detail without mentioning what aspects of the disease you should write. So describe the pancreas in detail, 10 marks. Now it is an open-ended question. You can write anything about pancreas in it and you can get marks. Now how it is different from a structured essay question? Now as the name is also different. The first one is long essay question or simple essay question, and now it is a structured essay question. So when you divide the same essay question into 2 or 3 parts, it is in the same line, but you divide it in theory in 2 or 3 parts and also divide the marks in 2 or 3 parts, then it becomes a structured essay question. Like the similar question about pancreas can be structured, like you can divide it into different parts, discuss the different or name the different parts of pancreas, and also mention the anatomical relations of the pancreas with the surrounding structures, and then mention the endocrine as well as exocrine functions of the pancreas. So now it is a very clear statement, a clear things are asked from you to write, as compared to the simple essay question in which you can write anything about pancreas with no clear path. Here you are asked to mention the different parts of the pancreas, mention its relations with the surrounding structures, and name endocrine as well as exocrine functions of the pancreas. So it is not only easy to attempt for students, but it is also very easy to mark for examiners, because the question is divided into different parts, and marking is also given, and it is a split like 2 2 3 3. So now it have got some purpose. So that's how structured essay question SEQ is different from long essay question. And now comes to the short answer questions. Now short answer question is a further refinement of a structured essay question. It is more target oriented as compared to SEQ, like it is started with a scenario, a clinical scenario or basic scenario will be given, and then you will extract the positive points from the scenario with your past clinical knowledge, and then you will answer the stems 3 or 4 questions, and that will be very targeted. Like here I have given a scenario of 40 years old male patient which is diabetic for the last 10 years, and he came with a complaint of sudden decrease of vision, and his fasting sugar is 200, which also shows that uncontrolled diabetes. And as he came to the ophthalmologist and you with a sudden decrease of vision, you perform distant direct ophthalmoscopy and there is a poor glow. So now scenario has been in front of you, and you have read it, and in your mind now you will make differential diagnosis that what can be the cause of decrease of vision. So now here you are asked very clearly, name the two most likely differential diagnoses. Now if you write the three differential diagnoses, you will not get extra marks. Maybe your marks are deducted because you are asked two conditions and you have written three. So always concentrate on the questions asked in SAQ, that what is the requirement of the exam. Then the next question is that name the investigation, because you have got a hazy media, so which investigation you would like to perform. And then you can be asked about the treatment options, that what how will you manage the above two differential diagnoses. And the marks will be again split just like in SEQ, they were at the end of the statement, but here in SAQ, as you have got 3 or 4 questions asked separately, so at the end of each stem there will be marks written. So SAQ is a more refined form of essay question, and it is called short answer question, and it tests your higher order cognition, and that's how it is constructed. And now again the same scenario of SAQ, now I will apply on modified essay question, MEQ. So again the same scenario, 40 years old male patient, diabetic for the last 10 years, presented with sudden decrease of vision, fasting sugar is 200, and there is a poor glow. So now again the first question will be, what's your differential diagnosis? Now in a list you will be given different differential diagnoses and you have to choose the correct one. When you click on the correct one, then another stem opens, like okay, your differential diagnoses are correct, that the patient has got vitreous could be diabetic vitreous hemorrhage or diabetic sudden development of snowflake cataract. So suppose it is a vitreous hemorrhage, then which investigation would you like to perform in order to ascertain the health of the retina? So then the options will be given after the second stem: A scan, B scan, FFA and OCT. So then again if you click the correct one like B scan, then you can be asked that now what could be the management option for this diabetic vitreous hemorrhage, and you will be given options like observation, anti-VEGF injections, pars plana vitrectomy or laser. So now you have made 3 questions from the first scenario. So that's how modified essay questions are made. So I hope after watching this video you will have some idea of long essay question, how it is different from structured essay question, how short answer question is made, what are the differences of short answer question from structured essay question, and modified essay question. Thank you very much.